marking being done, I generally like to mark with the Saurabh Patwardhan marker, usually any two random points. It's a fantastic tool made for Android phones. Based on the marks, perpendicular to the marks I have shown you at 180 were the original marks, which were at 85, and I'm just checking that those two marks are at 85 and my two sharper marks are at 180. I think that was viscoat. Once again, the video has not been fast forwarded. Introduction of the cystitome made upside down so as not to cut the side of the side port. Cystitome needle should be bent by using the elbow and the shoulder and not the joints of the wrist or the fingers. Little egress by depressing the posterior lip to create volume. Sometimes just breaking the quadrants into smaller pieces helps. When I started doing phaco 25 years ago, I used to just keep watching the videos again and again. Now completed more than 30 to 33,000 phacos. Taking the help of the left hand and the irrigation cannula. Instead of tugging like this, if you just use the other hand, it becomes much easier. The only difference that I would do in a toric lens versus a non-toric lens is wash out the viscoelastic really well, because that can create a potential space for the lens to rotate. So I'll go below the lens and flush it out with PSS. Also, another practice which I've not done in this case but which I like doing is not to inflate the bag too much or the anterior chamber too much at the end of the case. And I also like to leave a small air bubble which acts as a tamponade, pinning the lens to the posterior capsule, sort of like a burglar pinning somebody against the wall. Maximum rotation is seen in the first 24 hours, and it takes around the same time for the air bubble to absorb. And the only thing is that if you plan to not pad the patient, then you have to warn the patient that you may not see immediately, but this has been done for his or her own benefit to prevent the lens from rotating. In these cases, I do like adding pylo. Somehow the added weight of the iris onto the lens also prevents it from rotating, and sort of snugly secures the lens, just checking where the markings were. And you can see the 3 Purkinje images, the first and the second, and then the first and the third, and then the fourth, which is inverse.